All right, welcome everybody back for our third of our 5 sessions today. During this segment, we will be talking about the prevalence of suicide and programs and services to support those that are in our veteran community. So as people kind of join us back online, and some of you guys have been with us all day, just a couple notes so you kind of know what's happening here. I want to welcome everybody here in person. Thank you for attending, as well as our 5 campuses throughout the NTC area. Everyone that's joining us online virtually, and anybody that's joining us after the event on our YouTube channel, thank you for taking the time to be a part of this today. We would not be here without the support of the Advancing a Healthier Wisconsin Endowment as our funding partner, but also NTC Workforce Development and Training. Darn it! Professional training. Yes, workforce development and professional training. It's taken me 3 times. I'm excited that I got the grin from our co-host here, Leslie. So welcome everybody for being here. Before we get started, I'm just going to do a brief video presentation from our sponsor, and then we'll get on with the program.
Hello, my name is Iguchi Madokwe. I am the Deputy Director of the Advancing a Healthier Wisconsin Endowment, and I'm honored to join you at this important learning event focused on building capacity to prevent suicide in Wisconsin communities. The Advancing a Healthier Wisconsin Endowment, or AHW, is Wisconsin's largest health improvement philanthropy and the only health philanthropy in the nation stewarding public funds from within a private medical school, that school being the Medical College of Wisconsin. AHW was established by MCW as the result of a generous financial gift made by the Blue Cross and Blue Shield United of Wisconsin to the people of Wisconsin, giving AHW the extraordinary responsibility to steward this financial gift on behalf of Wisconsin residents. We do that by investing in promising biomedical research, supporting community health initiatives, and building the health workforce needed by Wisconsin. Since 2004, AHW has invested in $337 million in 600 projects. The Learning and Event Support Grant we provided to the Taylor County Health Department for this event is just one of many funding opportunities AHW offers to community-based health organizations and other nonprofits, as well as MCW researchers to propel promising work and ideas aimed at improving health and advancing health equity in Wisconsin. I invite you to visit ahwendowment.org to learn more about opportunities to collaborate on our shared vision of a healthier Wisconsin. Thank you and enjoy this day of learning and networking. I have no doubt you will receive both information and inspiration that will benefit the important work you all do.
So before we begin, just a quick note that all the handouts and resources that are shared by our presenters throughout the day today, as well as additional resources and handouts that are more than just what's available here in person, they're all getting loaded into this drive. So you can continue to visit this drive. More resources will be added to this drive over time. So it may be something that you want to bookmark, if you will. So you can either scan the code or go directly to that drive. I will make sure that we put this back up at the end as well. For those of you that maybe are new with this, those of you that are joining online, this will also be added into the chat in just a bit. So it's my honor to welcome Alyssa Knoll here today from the Oscar G. Johnson VA Medical Center to talk to us a little bit about this population, about this group of our community. So with that, I'm going to stop share for me, and we're going to let Alyssa take the control.
Can you see the presentation yet?
Yes. Just have to make sure I get it up correctly here in the room and get rid of some of this extra stuff. And away we go. Leslie, look good for you? Perfect. Excellent. All right, Alyssa.
Well, thank you so much to everybody who has put time and energy into creating this event today, and for those organizations who are funding this opportunity. Myself and Carol Ewald put together a presentation for you today, and I will, at the end of my presentation, put her information in the chat. So to start with, my name is Alyssa Knoll. I am the Community Engagement and Partnership Coordinator at the Iron Mountain VA in Michigan. And we do cover from our facility 9 of the northern Wisconsin counties, including Langlade County, which is why I'm with you today. And my partner, Carol Ewald, who is unfortunately due to some emergent factors not able to be here today, she is from Toma, VA. And so most of the individuals who are participating in this event, she is going to be your contact person. And I will be sure that the last thing that you have from me and the easiest thing for you to find is her contact information, because I know that she's eager to connect with all of you in this really important work of taking a public health approach to suicide prevention for our veterans. So today I'm going to share with you about ways that veterans are different from the general population. This is an education, some slides on raising awareness around how veterans are a little bit different than the general public. To start with, I'm going to share a little bit with you about the public health strategy that the VA is taking. We know that there are a number of suicides every day. It's in the 17 to 18 range. What we've noticed over the past years is that there's a decrease in suicide for veterans who are connected to the VA. And on the slide that you're looking at, that's those clinically based connected veterans. They're receiving primary care or mental health within our VA system. What we have also noticed is that suicides are not decreasing in the community. So veterans who are not using VA services and they're using organizations, they're attending schools, they're living and thriving and working in their community and not connected to the VA. And that is our area of veterans, a population of veterans that are at higher risk at the moment. And that's on the slide, the community-based circle that you see. So the VA is really looking at, instead of taking a facility or a VA look at veterans, saying we need to take a public health strategy, means stepping back and looking at all veterans in every community of every ethnicity, all of the underserved veterans, and not separating out, well, these are the ones that go to the VA and these are the ones that don't. So our role in our community and engagement and partnership coordinator is to take that public health strategy and really look at how do we create safety nets at the community level to prevent suicide in our veteran population. So that's that community-based circle. And when we add those two things together, we get the full public health model, that wraparound services where we're integrating all veterans into suicide prevention. Here's another way to look at that. It's a lot of circles, but notice that it starts in the center at the community level. The work that we do impacts individual veterans, but we're not directly doing direct veteran care the way a primary care doctor would be one-on-one with a veteran, or a nurse, or audiology, somebody who's coming in for hearing aids. They're providing a direct service to veterans. Our approach is to step back to that community level. And how do we identify service members, veterans, and their family members? How do we promote connection between services and veterans and healthcare, whether it's VA or community resources? How do we connect to veterans who aren't going to walk through the doors of the VA? Nationally, we know that there's over half, around 65% of veterans in the community that will never utilize VA services for a variety of different reasons. So looking at that community level, you have our community engagement and partnership coordinators. That's Carol and myself. There's a program called Together with Veterans, which I believe I should have asked Carol. I believe it's out of the Monroe County, and kind of seated close to Toma, is where the headquarters for Together with Veterans is for your area, but it outreaches to all of the rural counties. Together with Veterans is a program that was created to be a grassroots. So at the community level, veteran to veterans, and they create healthcare fairs, they create activities for well-being, they connect veterans to other veterans, and it's veterans doing the work themselves. So it's a real peer-to-peer based program. And then you can see the other circle, the outreach and education. That's like this event today, providing outreach and education about veterans services, about gaps and issues that our veterans face. And the VA said, okay, so we have these community-based interventions for suicide, and we want to filter and make, I'm going to say, a bridge between what we know is working in the VA and providing those resources to our community so that they're able to offer the same level of support to veterans in the community and have the same understanding. We hear very, very often from veterans that are connected to the VA that one thing that they love about it is how individualized and military focused the VA is. When they walk through the doors, they know they're being served by people who understand what they've been through to some degree, even if we don't know their exact story. And so we want to provide that type of education and support to our community members so that when a veteran walks through your doors, you feel equipped with the knowledge and the resources, or at least the person and the phone number to call to connect them so that they're able to get where they need to get. So that's that community level. And then at the state level, SAMHSA and CDC and national VA got together and they challenged all of the governors in the nation to create a veteran-focused suicide prevention coalition, and that's called Governor's Challenge. And Wisconsin accepted that challenge. Governor's Challenge is a collaboration that works on identifying service members, veterans, and their families, and once they're identified, looking to make sure that they're being screened for risk, because veterans are at high risk, and we're going to talk about that in just a minute. And also looking at promoting connection. How do we, and that's very broad, how do we connect veterans to each other? How do we connect them to services? How do we connect them to their community? How do we connect them to their families? And we also broaden that out for the scope of our project to really be looking at service members, their families, and also caregivers, because we know that service members need support as they're transitioning from that role out into their civilian life as a veteran. That's one, we're going to talk about that in a future slide as well. So the Governor's Challenge is really meant to look at all of those things along with lethal means safety. How do we reduce access to means? We know that 70% of our suicides for veterans are due to firearms. We also have overdoses as the next highest. And so how do we look at ways not to take anything away from people, but to keep them safe for a temporary amount of time if somebody is in crisis and needs that support? And then also creating safety plans. And some people may be familiar with a safety plan that an individual has when they come into a mental health department. If you want to think about that, like where can a veteran go? Who can they talk to? What can they do to distract themselves if they're in crisis or struggling with suicidal ideation but don't have an intent and plan? What are the things that they can do for themselves? We're really looking again at that public health approach. So stepping back from that individual to the whole population. How do we look as a community and say, here's some areas in our community, whether it's looking at ways to store weapons when somebody needs a place to put them temporarily, resources to help get rid of excess medications that aren't being used, looking at the community level and saying, how do we know where our veterans in our community are living, working, and thriving? And are we utilizing the resources we have in those areas? Are we reaching those folks to really include them in the work that we're doing? So again, really looking at that community level with the hope that the work that we do over time as a community changes the culture of our community. And then we start to make societal change around veteran suicide prevention, which is when we're really going to start to notice a change in the numbers. And so really starting at that community level to say, What does our community look like? Where do our veterans go? How are they utilizing services? Where are our service members? What things do their families need if they're deployed or not here right now, for whether they're at a natural disaster because they're in the National Guard or Reserve? What are the gaps in services that they need to help support them? It may even look like school systems looking at how can we offer resources, something as simple as a phone number. If a child is in distress, their parent is deployed or has been gone for a significant amount of time because they're active duty, how do we support the family with just a phone number even to help connect them? Oftentimes we know from research, a child who may not be able to know where their parent is because it's classified, or they know their parent has deployed and they're not sure they're ever going to see that parent again, that causes a significant amount of distress to children. It can be either parent and or a sibling, in the study and the research that shows that. So looking at that community, what do they need? What is a simple phone number that you can offer to that family as a means of support, so they feel like there's some connection and they're not just left out there on their own struggling? So community level support and safety can look a lot of different ways, and it just depends on your community. So here's some ways that we're going to get into talking about how veterans are different than civilians. When we look across 100,000 people for veterans and non-veterans, you can see the difference between these two. The coloring is a little bit difficult. So this top line going across the top here, the darker line, that's veterans. And the lighter line down here is a non-veteran or a civilian. So veterans die by suicide at a higher rate than non-veterans. In 2020, the age and sex adjusted suicide rate among veterans was 57.3%, higher than the age and sex adjusted rate among non-veterans, US adults or civilians. While the number and rate of suicide deaths increased among all Americans between 2001 and 2018, veteran suicide deaths consistently outpaced those of civilians. Veteran suicide rates decreased from 2019 to 2020 with a 4.8 decrease, and this is one of our anchors of hope. That decrease was seen within veterans who are connected to our VA services, and that's compared to a 3.6 decrease in civilians. So we did a little bit better than we were doing. However, suicide rates among veterans continue to exceed those of non-veterans. From 2001 to 2020, the age and sex adjusted suicide rate peaked among veterans and non-veterans. There's more work to do for sure. So now we're going to look at an overview of some of the highlights of this presentation. So veterans also experience higher rates of suicidal ideation and suicide attempts compared to their civilian counterparts. There's really important differences between these populations that may help explain some of the desperate suicide rates. We're really looking at what is different between, if you took one human being and you could look at them choosing to be in the military or them not choosing it to be in the military, what puts them at higher risk? And certainly we know that experiences that person had prior to going into the military impacts some of the complex trauma that they may experience going forward, depending on what their story is and what experiences they have. So we're going to look at that in a minute. Suicide rates among veterans has increased substantially in recent years, as it has for non-veteran adults, but our veterans continue to outpace their civilian counterparts. Excuse me. It never fails, right? You always get a frog in your throat right in the middle of a presentation. One of the ways that experiences that someone can have prior or pre-military are adverse child events. And adverse child events is really well known in school districts right now, and I don't know how familiar everybody on the call is with adverse child events. It's a kind of there's about 10 questions. Different resources word the questions a little bit differently, but it comes down to, did you ever experience a parent being put in prison? Did you ever experience homelessness? Did you ever experience your parents fighting? Did you ever experience sexual trauma? Did you experience physical, verbal, or emotional trauma? And it looks at those things that happened as a child and how did that impact your outlook on life, and those things also impact you physically. So if someone was bullied, this slide gives examples. If somebody was bullied, if they've had sexual trauma, those things put them at higher risk for suicidal behavior. And it's also noted that veterans have more of those situations and experiences, and then choose to go in the military over their civilian counterparts who don't choose to go in the military. So when we're looking at just people who are in our military service as a population, they have a high rate of adverse child experiences, which puts them at higher risk for trauma and suicidal thinking. Someone who's had trauma doesn't have to be suicidal. It's just another one of those additional risk factors that can be a component. And someone without trauma can be suicidal. They're not, one isn't causal to the other, but they're both can possibly be present. So if we look at military risk factors, so this is when we're looking at this person, they've decided to go into the military service. What is it about the military that increases their risk for suicide? If there is any kind of exposure to combat, excuse me, if there's any kind of exposure to combat, for some individuals, that can be a risk factor for suicide. Sometimes it's military sexual trauma that's happened. There can be traumatic events that happen as part of boot camp, bullying, other things that happen, accidents that can happen, injuries that can occur, and along with those accidents comes the possibility for trauma. Combat-related experiences, we're talking about someone who's been in a war zone, helped with a natural disaster. Trauma and combat can look different for different military members, and so there's not just a one-size-fits-all where that's considered. Think of it as witnessing violence, atrocities, moral injury. You know, if you have a belief that is put into question because of something that you're ordered to do, and it's a very strong core belief that, you know, core beliefs can be things like treat others as you would like to be treated, things that we've learned from as children. If there's a situation that a military member has been put into that goes against those core beliefs, they can experience moral injury in combat, and that can be a suicidal risk. Veterans with a history of TBI are at an increased risk for suicide compared with those with no history of TBI. Well, to kind of boil it down and simplify it, this is not the only reason why, but traumatic brain injuries can often create an impulsivity. And for some people, it can also put them at increased risk of substance use, which is also noted to be a risk factor for suicidal thinking. What you're seeing here in the people on the left-hand side of the slide here, these are male male military sexual trauma, and 3.9% of male veterans, or that little blue arm, experience military sexual trauma as a risk factor for suicide. So this isn't saying that that's the amount of people who have experienced military sexual trauma. They're saying that's the number of males who have also experienced military sexual trauma and have reported that that directly links to their suicidal ideations or thoughts. Please keep in mind that those who have completed suicide, we are not able to ask them directly. And so this number does not include people who have completed suicide. This is people who have attempted, have had suicidal thoughts that have been asked. And on the right-hand side, you'll see the same component for women. So this is women who have experienced military sexual trauma, and due to that trauma, they're reporting that that's directly correlated to their suicidal ideations, and that's 38.4% of women. We talked a little bit earlier about how as community engagement and partnership coordinators for the VA, we're really looking at that transition from active duty, Army National Guard, Reserve, U.S. Coast Guard, any type of service that someone is transitioning out of that role and into civilian life. Men and women are found to be more likely to report suicidal ideation during this time. The majority of first suicide attempts are happening in that separations of service period, and directly following that, they're most vulnerable for death by suicide in the first 3 months following their transition to civilian life. And veterans who are discharged from the military for disability, disqualification, misconduct, completed fewer than 4 years of service prior to separation are at greater risk for suicidal ideation behavior than those who went through a routine discharge. And then younger age at a time of separation has also been associated with a higher suicide risk. If there's anybody who is brave enough on the call that would like to chime in, any thoughts on why some of these facts, why that transition period makes people more vulnerable? And feel free, you can put it in the chat too if you want. I don't see anything in the chat yet, but if someone else sees something in there, please let me know. So the reason why the transition to civilian life is so challenging for folks. Oh, go ahead. Thank you, Will.
Hi, I'm Casey Crump. I'm with the Bemidji Area Indian Health Service. I'm the injury prevention specialist from Bemidji area. My experience is, at least with your second one there, the majority of those first attempt suicides following separation from service, there's that lack of discipline. There's that lack of standardization that we're used to. I'm a veteran. That we're used to in our daily lives, and all of a sudden that structure is no longer there, and that's taken away, and now we're struggling to go back into civilian life and figure out exactly what that's supposed to look like, what our job is supposed to be, who we're supposed to be now, because we've been told that we were soldiers and we do this and we do that and this is the way we do it. And now all of a sudden that structure is gone, whether it be separation for disability, disqualification, whether it be normal separation, whether it be retirement, whether it be EOT, the end of service time, whatever it may be. You've had that structure, and all of a sudden that's gone, especially for and again, the younger age that you're talking about down there at the bottom. If you go in right out of high school, you're going from a structured environment to a more structured environment, and then when you get out, you're on your own. You don't have your battle buddies. You don't have those types of things. And that's why with a lot of our veteran service organizations, we try to maintain that battle buddy mentality and try to get our folks involved. But I just thought I'd add that. I was looking at your list and thought I'd add it.
Thank you so much for jumping in. I really appreciate what you shared, and I think it's valuable for the folks here today to hear what you shared. It's hard to describe to someone who hasn't been in the military what it's like to go from having built-in camaraderie, built-in support. You're told when to wake up, you're told what to wear, you're told where to be, when to be there, how to be there. Everything is decided for you. And part of boot camp is stripping away all of what you've been before and looking at how do I build myself as a warrior, as a soldier, as a military member, as part of a team. And they build that in because when it comes to combat, a person has to instinctually react based on their training. And in order to do that, they have to trust the people around them with their very lives. So it goes beyond what you could imagine a sport being, where people, or a workplace team, that brotherhood, that and sisterhood, I include women in that as well, that connection that they have to each other, suddenly they're outside of the walls. And in essence, they've been shut out from the support systems that they've known for however long they're in the military. They're cut off from the very people they were trained to count on and to depend on. And sometimes in certain situations for disability or disqualification, they're also watching those people be deployed without them. And then on the flip side, in the civilian life, they don't always have skills that they learned in the military aren't transferable to the community. So they're looking and saying, I don't even know who I am. They feel stripped of their identity, and they're not built a new identity as they're walking out the door. Those things create a lot of unrest. And that's just the emotional and mental piece. That's not to even go into, they don't have a home, they don't have a job, they may not have transportation, and depending on their situation, they may or may not have supportive family or friends. And oftentimes when someone has been in the military, even going through boot camp, they will come back home and feel separate and different. They aren't the person they were because they've gone off and had experiences in life, just as someone who goes off to college might. The difference is that they come back and they feel so separate and so different, because people who come back from college have a relatable experience with other people who have attended some type of higher education, or their family is proud of them because they've done that. That's not always the case when they come back to their families. They may not have somebody who understands what they've been through, and their friends may say, wow, you're different, you're not the person you were, and they feel isolated, and there's a lot of loneliness. And those are pretty, along with that lack of purpose in life, those are two very strong risk factors for veterans. Veterans have been trained how to use their weapon. Their firearm becomes an appendage. It would be like all of a sudden what you have to protect yourself with is gone, and you don't have access to use it necessarily right away. Some people have weapons available, some don't, but it's different in civilian life than in military life. There's just so many changes that they're going through, physically, with housing and food insecurity, maybe not even having credit to take out a loan to buy a home or to buy a car. There's so many ways that impacts their vulnerability. So a lot to think about and unpack when it comes to our service members as they're transitioning out.
We just had a couple comments. Hold on.
How about now? We had a couple comments online. Just to give you an idea, hopefully you can hear me okay. The younger age, they're still trying to find themselves, and the structure is now gone that they've been used to. And that civilian life doesn't stop while they're away and continues to grow without that that they have to come back and have to figure out how to adjust. So there was some agreement there. The loss of purpose you mentioned, the loss of routine, the loss of identity, the lack of that connection with peers was also mentioned in the chat.
Yeah, and I think for our younger folks who really believed that their identity was going to be a military career, and then maybe it did not end up being a military career, really throws them into that. Well, what am I going to do now? Who am I if I can't do this? Because this is what I wanted to do. So that loss of purpose that Kari put in there, loss of routine and identity. And civilian life doesn't stop either. That's absolutely correct. It kind of grows and goes on, and they may have a really hard time coming back and feeling disconnected in that sense as well, Sharon. Thank you for putting that in there. Very good point. Thank you for those comments, everybody. I appreciate it. So just a few more facts about veterans and how they're different in that transition back to civilian life. Recently separated male veterans were found to be at an increase of suicide via firearm, which we talked about compared to the general population. And that's actually raising for women right now as well. More women are choosing to use a firearm as a plan for completing suicide. And it's more lethal, obviously. So oftentimes people who have chosen that method are successful more often than not. Veterans who transition to civilian life are marked by worsening symptoms of PTSD. That can look like depression. It can look like anxiety. It can look like both. It can be outbursts of anger, substance misuse. Oftentimes, substances are being used because they either want to escape or numb. Those are usually the two reasons any human being reaches out to substances. And strained relationships, and we gave some examples in the last slide of what that can look like. More than half of veterans have reported a chronic physical condition at 3 and 6 months following separation. And a third of veterans reported a chronic mental health condition. Oftentimes, those things are happening even while they're in service. But this isn't true of all, but most service members went in because they wanted to deploy. They wanted to be ready. They wanted their country to call on them. And so they may be experiencing some of these things, physical conditions, chronic mental health conditions that they don't want to bring up while they're in service because it may keep them from deploying. And it often takes time for someone to re-engage in their life and in their community and in their home space before they start to realize, oh, my knees really bother me, or my back seems to really bother me. And then they feel safe enough to really seek out help for those things. Just checking the chat to make sure I didn't miss any last comments. So let's talk about risk factors, and keep in mind, just because any human has risk factors, that doesn't automatically mean that they're going to be suicidal. And for every person, what's considered that tipping point from I can manage my life to I can't, and I want to escape either the pain or the situation, and I don't see a way out, is different for every single person. Someone who has had many, many, many experiences and been deployed many times may not have any problems with PTSD and may not have any suicidal ideations, even though on paper it would look like they have risk factors. It depends on the person. It depends on how they see situations and the perspective that they choose to take, whether it really truly becomes a mental health problem for them. And physical ailments, the injuries that we talked about in the last slide, for some people that alone can be enough of a risk factor. So recognize when we're talking about risk factors, if somebody has all of these things, that doesn't automatically mean that they're suicidal. It does mean that you need to be cued in and paying attention, because they need somebody to be saying, how are you? Let me check in with you. How can I help you? How can I support you? Because they're starting to get more and more things layered on. But it doesn't automatically mean that someone is suicidal. Everybody is different. And suicide is such a complex issue. It's never just one thing. So they might say, the one thing that really bothers me is that every time I start my car, it clicks 3 times. And you might go, well, that doesn't seem like a reason to be suicidal. But what they're not telling you is all of the other things that have added up to that one thing being like, I can't take it anymore and I don't want to be here. So be mindful of that iceberg effect, that what you see and what they're saying is the problem may just be the tip of the iceberg. And sitting and listening and asking questions really gets you the full picture of the weight and the heaviness that that person might be carrying. So we know that people who are in rural areas, no matter who you are, that is a risk factor. You have less access to care. So we're taking all of the previous slides, the risk factors that are directly related to the military, and we're saying they have these military risk factors, pre, active, and transition, on top of being in a rural area. So that when we're looking at comparing civilians, you can say, well, a lot of people live in rural areas, and that's true, and they are at risk. And the reason why veterans are at higher risk is because they have that same risk factor of being in a rural area, and they have the other risk factors that we talked about previously. They're more likely to own or have household ownership of a firearm when compared to civilian counterparts. I want to say some of the research I've seen, it's about 90% of service members who transition into civilian life own and have a loaded weapon in their household. In 2020, firearms accounted for 71% of all veteran suicides. 50% of those were non-veteran U.S. adult suicides. So you can see that veterans are far and above using a firearm more often than their civilian counterparts. Approximately 30% of veterans who received care through the VHA had a confirmed mental health diagnosis, and 37 had a possible mental illness. Now remember, a person can have mental illness and not have suicidal thinking, or they can have mental illness and also have suicidal thinking. The mental health doesn't have to be the driving factor, but oftentimes we're seeing someone who has attempted or completed suicide has depression, anxiety, pain, a new diagnosis, for example, cancer, diabetes, kidney disease, chronic illnesses that are terminal, those often carry more suicidal risk. So we're just doing kind of some more of the same here. When we're comparing a homeless civilian to a homeless veteran, they're more likely to have attempted suicide. Men and women veterans with a history of justice involvement are almost 3 times more likely to report suicide attempt than a veteran with no justice involvement. One of the newer things that is literally on the cusp of happening within the VA system right now, we are having our law enforcement, a mental health representative, and our homeless and veteran justice officers involved in what's called deflection training. And deflection is really looking at maybe a police officer has been called to somebody's house 7 times and they've never given any charges to that person's never been in trouble. The police officer's just going there to talk to them. What kind of resources can we equip those law enforcement paramedics, EMTs with, so that as they're having those interactions with people, veterans specifically, we're giving them veteran-specific tools and resources so that maybe they're getting connected during those encounters and keeping them out of the justice system. When we're looking at people in general with mental health, we know that our court systems and our institutions, justice institutions are full of individuals who have mental health. And the VA is really looking at how do we engage those folks in treatment and keep them out of the justice system. So that's not an additional risk factor on top of whatever else they're experiencing in their life at the moment. This one is really important. The rate of severe pain may be near 50% higher among veterans than civilians. Chronic pain may be a risk factor for suicidal ideation and action. When we're talking about our military members, they are put through rigorous training. They wear rucks that can weigh 60 to 80 pounds. They can be carrying equipment on top of that. And they're hiking up and down hills and for miles. So the amount, and that's just, we're just talking boot camp and training. We're not even talking about what they may have experienced physically while deployed. So, and by deployment, I also mean in natural disasters, not just wartime. We've had our Army National Guard was deployed during COVID-19 to help with shots. There's lots of reasons why the U.S. Coast Guard would maybe be out doing something in the waters, protecting our country. And all of those things are in that deployment for when we're talking about the severe pain piece of it and the experiences that they've had. Most often than not, in my experience as a clinical social worker here at the VA, veterans are experiencing pain in addition to their mental health and other things that are going on with them. And that is definitely alone a very important risk factor to be taken into account if you're working with somebody who's a veteran. So some things I want to make sure that you take away from today's training is that there are very important differences between veterans and the general population that help to explain the difference in suicide rates seen between the two. Veterans report a higher rate of adverse childhood experiences than their civilian counterparts. Especially back in the Vietnam War, kids who were in trouble were often offered by their community justice system, you have a choice. You can go and sit in county jail or you can go in the military. And so that's one of the examples that I've heard of this type of a situation. Combat exposure and some combat related experiences are associated with suicidal ideation and behavior, those traumas. And someone who's had a trauma before they go in the military, the traumas or the combat exposure that they experience then becomes complex trauma because it's trauma on top of trauma. And veterans are at increased risk for suicide immediately following separation from service. So if they're walking into your school, if they're walking into your bank for a loan or to open a checking and savings account, if they're walking into the grocery store where they've never had to think about how to grocery shop or how to cook a meal because it's been done for them, and they feel overwhelmed at the prospect of trying to figure out what do I need just to make a meal. We're talking about day-to-day life experiences where anybody in the community, one of the things I hear the most often from people who were considering suicide is, I decided not to because somebody talked to me or they smiled at me. Listening is the key to suicide prevention. And it's one of the easiest things that anybody on the planet can do for somebody else. So everybody here is in the front lines and can be an advocate for suicide prevention within your community. Some calls to action. The slides are going to get shared out, so you will have access to these links. There's a multitude of mental health services that are available through the VA and also the Vet Center. If a veteran is not comfortable coming to the VA, and veterans who are maybe not eligible for VA benefits are eligible at our vet centers across Wisconsin. So that's another resource. any veteran who's had a military sexual trauma, they automatically are eligible for VA benefits. They will receive coverage for that MST experience. If they were physically injured in the process of that sexual trauma, they will then cover any of the physical costs or the mental health needs that the person needs. So VA provides help with treatment and healthcare related to MST experiences, and there's a link there that you can see. Unemployed veterans, that the VA offers a multitude of career and employment resources. I know here at our Iron Mountain VA, we actually created a partnership between us and the Ottawa National Forest. And the Ottawa National Forest is able to direct hire veterans. And so now we have an agreement that when our voc rehab specialist gets veterans who are interested in working in the Forest Service, she automatically connects them to those direct hire opportunities in the National Forest. So we work with people who are looking for competitive employment. We also work with people who have severe mental illness that are looking for ways to volunteer or find a sense of purpose and just do what they're capable of doing, not necessarily looking for paid employment. And we also have other employment support systems in place for any level that the veteran is really looking for as they're entering that employment. So for any kind of suicide prevention information surrounding veterans, this very first link here that says MIRECC is MIREC, our Rocky Mountain Mental Illness Research and Education and Clinical Center. They also have free swag. So if you're ever looking for things to put in for conferences, they have bags and they have post-vention information. They have suicide prevention data on our veterans. Just a plethora of resources are available to you at that link. One of my favorite VA resources of all times, oops, sorry, I clicked on it. I did not mean to do that yet. It is this bottom link called Make the Connection. If you go into Make the Connection link and into the search function and you type in suicide, it will give you videos of veterans talking about their experiences and how they got mental health help. So if you're a civilian and you need in that moment to have a veteran telling another veteran about any kind of life experience, there's individuals who were in the military during Don't Ask, Don't Tell, and there's videos of them talking about that experience. If you need, for any reason, you're sitting with a veteran and you need them to not feel alone, go to the Make the Connection link and type in whatever word is kind of a key word for that veteran, and you will get a plethora of other veterans talking about their stories and their experiences. And you can access my slides at any time. It has been uploaded to the Google Drive, so you have this available to you whenever you need it. There's multiple resources on lethal means safety. Veterans who feel isolated, the most important thing you can do for them is listen. And beyond that, look to create connection. Whether it's a hobby, whether it's with another veteran, no matter 5 minutes, if you offer that person space and time, you are doing life-saving work in that moment. And then, of course, our veteran crisis line. I want to point out that 988 is the national crisis line for everyone. What happens when you press 1 is they go to a specific veteran crisis line individual who has been trained to ask questions related to military service. When a veteran presses 1 and talks to the veteran crisis line, nationally, whatever VA that veteran is closest to, the suicide prevention coordinator gets notified that that veteran called, and regardless of whether they are eligible for services or not, that suicide prevention coordinator will reach out to them and offer them support and try to connect them either to the VA and or to their community resources. And when it comes to a veteran in crisis right now, the Compact Act is just starting to roll out, which increases services for veterans who are eligible for services but not connected to the VA. And there's a national number that can be called. I will get that number to Melissa to share out to everybody. If somebody is in an ED or is headed to the ED, a family member, the ED person, it doesn't matter who calls. If that person is a veteran, they can call the national number and for the Compact Act, and it's possible that the ED services and all of the following mental health services will be covered by the VA. So that's a very brand new, like, we're just rolling that out and people are just going to start hearing about it in the next month. So there will be more to come to your community on that for sure. There's lots of data that we pulled to put this presentation together. The data sets are here if you'd like to look at any of that information. And that is the end of my slideshow. So I will stop sharing. Again, thank you so much for having me. Are there any final questions?
So one of the things that I just realized, I don't think, William, thank you for pointing that out, because as I'm looking now, I'm like, I might not have actually uploaded her presentation. So what I'm going to do is I'll organize this file, this folder, when we're done with the Q&A on this portion, and make sure that we get all that stuff put up there appropriately, that our presenters shared resources as well as other resources. So thank you, William, because it is not there. You're the best. Thank you, Alyssa, for your presentation today. One of the things that was pointed out by Corrine, thank you, Corrine, to connect with your county veteran service office. And we actually have our Taylor County representatives here today. So if everyone's all right with this, if there's specific questions for Alyssa, I see Jenny's got her hand up. I'm going to make sure I call on that. We're going to take specific questions for Alyssa, and then we're going to turn it over to our local reps. Jenny, go ahead and unmute yourself if you'd like and ask your question.
It's not really a question. I just wanted to point out something that Alyssa had mentioned about the soldiers doing ruck marches. My 3 daughters are in the Army National Guard, and every year for the last several years, 4th HUA puts on a suicide awareness ruck march in Green Bay on Veterans Day. And what they do is hundreds of soldiers put on ruck marches, or put on their rucks. They put in 60 pounds, whatever their ruck would weigh, and they march. They ruck. Sorry. For the amount of soldiers, veterans that committed suicide the year prior. When we started, it was 22. It's down to 16.7. So if you're interested, it's open to everybody. You don't have to pay to do it. It's awesome.
Thank you for sharing, Jenny.
Yeah,
If at any point those are shareable events, please make sure you reach out to your local health. I would recommend reach out to your local health departments and veterans organizations to be able to get some of that stuff to really, spread like wildfire through the socials. We'd be delighted, I know, here in Taylor County to share that event every year. Thank you, Jenny.
Thanks, everybody.
Any other questions or comments right now based on the presentation from Melissa? If not, I'm going to turn it over to Sheila and Karen. I don't know who's speaking, but thank you, Jenny, for putting that in the chat. And if you have any information, Jenny, like a fact sheet, flyers, or anything like that, surely I'm going to put my email in the chat. Please email me And we'll make sure we add that to the Google Drive.
Thank you. I appreciate it.
You're welcome. Thank you. You could talk anywhere between here and the TV.
Okay,
So I will, we'll get something up behind you. Go ahead.
so I don't really have a lot to put out. We brought our brochures that we have to put in the office. There's many programs that our local community has to offer. Healing for Horses is one of the local resources that we can offer. I have information for that back in the office. We'll have it up on our Facebook page here shortly. Karen and I both are fully accredited and can assist you in filling out your claims for service-connected PTSD, or point you in the right direction for that. Feel free to stop by. I have business cards also. And any questions?
Point out lots of material up here. Please take the material, any of the material that we have back to your organizations to be able to share. We also have veteran sponsored or shared with us veteran gun locks that do include the veteran outreach numbers, which can be used within your organizations as well. We can surely, Kieran, do you have a question?
Yeah, I'm just thinking about families, vets as well, because they usually go through a lot too. Is there support groups available for them, and also educational material to help them help the vets do this as well?
Alyssa, are you, so is there stuff, anything that you know of locally in Taylor County?
Oh, your veteran service officer is always the first contact, and then certainly statewide you have the Wisconsin Department of Veteran Affairs that is very available. I couldn't totally hear the question, so is there specific
Resources for families.
Okay. So the VA does offer some support to families, especially if the person is eligible to be considered a caregiver by the VA definition. There are support groups. There are oftentimes, depending on the situation, they can be eligible also for VHA benefits, so healthcare benefits. They can utilize mental health services if they are part of the legacy program. So there's some different kind of steps to go through, and reaching out to the local VA is going to be the best option. The veteran service officer is also going to be able to help determine some of those benefits, because they're connected to the VBA, which is our benefit side of the house, where I'm the healthcare hospital side of things. But also the vet centers can offer quite a bit of services, wraparound services to the families. And the VA and the vet center both offer couples counseling. The VA has a couple of programs that are geared towards couples, like Strength at Home and a few others. And those are actually like weekend workshop events, or it'll be a group that's set up for a number of weeks in a row. And there are times when even children have been wrapped into some of the outpatient therapy as far as family is concerned. They don't directly come in and talk to the counselor, but the counselors who are offering couples therapy can offer parenting counseling as well, as far as how to handle some situations at home. And I think that the vet center has some of those same kind of opportunities to do support groups and couples counseling and therapy in that family sense, but not directly to children. Does that answer the question?
Thank you.
Yes.
Okay.
And as well, you know, the calling 988 does get you connected. So families can always use the 988 number as well. Our previous presenters have talked about that quite a bit, but I think it's worth repeating that it is really a place for not only individuals in crisis, but those and providers that are working to support those individuals as well as in families.
Yeah. And for us, the veteran crisis line is the 988+1, and a family member can call and say, I'm calling on behalf of my spouse, my partner, my significant other, and that person can be in the room with them or not, and they will be offered support that is available to them that way.
Absolutely. Question, comment?
We also are set up to be able to have veterans do their telehealth appointments, so if they have a mental health appointment via telehealth, they can come into our office, check out a computer, do that appointment in our room across the hall. And we can walk them through that.
Melissa, can you tell me what the question was? I heard telehealth and that was about it.
So our local veterans office, does have space to be able to check out laptops, to
Nice.
be able to do their telehealth appointments there, on site there at the courthouse, to be able to have access to those appointments if they don't have other means.
And the VA has something called Digital Divide. Veterans can also be issued, who are eligible for services through the VA, can be issued an iPad to utilize for telehealth for VA services as well. And those have a hotspot in them, so the veteran also does not pay for internet Wi-Fi.
That's excellent. All right.
Thank you,
Other
everybody.
Any other questions from our participants around the horn, if you will, or any other comments or observations?
What resources are available for the veterans or civilians alike that would kind of fall between the cracks?
Alyssa, did you hear that?
No, I didn't. Sorry.
Sure. What resources are available for veterans that may fall between the cracks? Or civilians, he said as well, but with veterans specifically right now?
When we're looking at the folks falling between the cracks, that's really why they created my position 3 years ago, because they're recognizing that that's happening. And the hope would be that as we partner with our vet centers, our community members, our organizations, that less of those people will fall through the cracks, because the community itself will actually start to fill in those spaces where people kind of slide off one way or the other because they're just not eligible. I think a big part of it is also raising awareness. I oftentimes, I was planning to do it today, but realized that there are so many counties involved that it was going to be difficult. But when I give these presentations, I often like to share what percent density of the population is veterans. I think veterans don't always realize or always want to ask for the help that they need. So people in the community just don't even know that they've served in the military. This is really most often true for our female veterans. And if you have a veteran who didn't deploy, sometimes they will say, oh, I'm not a veteran, or someone else. Happens all the time. Veterans will say, I'm not going to take services because I want them to go to somebody else. And when it comes to our community resources and our VA resources and the vet center resources, I really encourage people to look at it and say, you signed a piece of paper, you took a job that you were willing to do, and this is your package of things that you, because you agreed to do this job, you were offered this package of benefits and you've earned it. So utilizing it doesn't take it from anybody else, because it was assigned to you the moment you signed the paper and agreed to sacrifice yourself for your country. And so it'd be like working in a career at an organization for 50 years and then saying, oh no, never mind, keep my retirement. I want it to go to somebody else. It's very similar to that. Every person who has signed and enlisted or was drafted earned these benefits, and those benefits are there for them. the cracks are tricky. We've got to identify where those cracks are and where those service members and veterans are falling through the cracks. And then once we do that, we have to pull the community and the VA together and really interlace all of the services to try to keep that from happening. If you have identified cracks, and there's something specific that you're thinking about, please email me, because that is mine and Carol's job, is to look at the cracks and say, okay, if the VA, if they aren't eligible or don't qualify, how do we build that safety net in the community? Who can we pull together in our network and in our connections? And identifying people who want to work on it is also very important. So if there's a crack that you feel particularly passionate about, we are here to be your technical assistants and offer you networking, support, physical assistance, and bringing people together around that issue. And that's exactly the work that Carol and I are meant to do. So we are here. We want to partner with you. If you see a gap, if you see a crack, if you identify people who aren't getting the help that they need, we want to know about it. And so do your veteran service officers.
Thanks, Alyssa. Great question. And I think that that's where having events like this, and this video again is going to be available after our event to be able to share in its entirety. So please share this with your networks. Let people know that there are resources available, not only locally within our office at the courthouse, but then just on a state level as well, to be able to connect people to. So great opportunities here for partnership. Okay. If there are no other questions, I don't see any more coming in there for where questions are so good here. Just gonna couple different notes here for this presentation. As I said, I'm gonna tweak in this drive to make it a little more organized, a little more user friendly. But if there are resources that you'd like to see us be able to add to this as well, please send them over to me. My email's in the chat online, as well as people can reach out to the Taylor County Health Department too. Just to remind people that we do have an optional QPR, which is question, persuade, refer training today here in person, but it is something that we're able to take to organizations to be able to do out in the community, not only in person, but online as well. We are able to do, there's a number of us now in Taylor County that are able to do this training online. There's a number of people throughout this state that are also able to. So if you're joining us from another area of the state, definitely reach out to your local health department. A lot of the times they're connected to those that are trained in this, as well as your UW extension offices.
What do you recommend for people who say like I'm a veteran, I have a lot of friends that are veterans, but then I also have civilian friends too, right?
Yep.
If you're the veteran, not a trained worker, and say all the reason about it, then.
Yep, absolutely. Absolutely. And it's providing that helpful help for sure. I appreciate your comments. And for those of you that were not or couldn't necessarily hear, a gentleman was sharing his story of going through, when he was going through, I'll just say it, the shit. And he had a buddy that helped him through, and now that buddy's going through struggles and just making sure that he's able to help him in a helpful way as well. So, thank you. That's exactly why we're doing this conversation today. And it's the beginning. It's just the beginning of the conversation. So, I think what we'll do is I'm going to make sure everybody recognizes we do have evaluations for each one of our sessions. If this is the only session that you are attending, please make sure that you do fill out this a session and then check that you attended this one or any sessions that you've attended throughout the day. You can just fill out one if you're online. Those of you that are here in person, if you're not attending other sessions, I have the evaluations over here that helps us plan for future events. But I appreciate everybody. Alyssa, I know had to run. Carol, she put Carol's information into the chat as well. And we'll make sure that you guys have that information on the summary outline bios for the day.